University School of Medicine for helping make the day possible. We are grateful for both of these fine ladies. I also want to thank both of these institutions, which are vital to the assets in our state's healthcare ecosystem, and both of the leaders that have contributed to the well-being of their fellow Georgians in many important ways. In addition to her many responsibilities as head of CHOA, Donna also serves on the Grace Commission, helping Marty and the team fight human trafficking in our state, so we appreciate that. And in addition to helping grow our healthcare workforce, Jean Sumner has served on the Georgia Board of Medicine and currently serves on the Behavioral Health and Developmental Disabilities Board. We're also very excited to have Governor Nathan Deal back with us today. I will note for the record, that he has his hometown Mercer Bears tie on. So he is sporting the colors today, and it's just an honor to have him with us. But also just want to take a moment and thank the governor for all he did to help grow the number of healthcare heroes that we have in our state during your time in office. The work his administration did to grow the number of residency slots and the investments he made to see that work through not only met the needs of that time, but it also helped us weather the challenges of the pandemic that would come later, and that we were able to keep more doctors in our state. So we appreciate your great leadership. Thank you again for that good work. I also want to commend Lieutenant Governor Burt Jones and Speaker John Burns and members of the General Assembly for their outgoing partnership in addressing the healthcare workforce needs of our state. We have a great team that has been working on this issue, certainly in the past with Governor Deal's leadership, but we have a great team that is working on this issue now, and I appreciate the Lieutenant Governor and the Speaker for taking the time to be with us today for this important announcement. This is certainly a major issue when you think about the healthcare workforce right now, especially in rural parts of our state. And with all the partners you see here and many others, we're continuing to improve healthcare access and quality through innovation. Today, we're making another major step in that effort, especially when it comes to rural areas of our state and our youngest citizens. Over 500,000 Georgia children currently live in rural counties, and at least 24,000 babies are born each year in these places. But fewer than 200 pediatricians live and work in those same counties. And as I said in my State of the State address last month, 67 counties in Georgia have fewer than 10 physicians, and even more alarming, roughly 65 rural counties have no pediatricians. That's why, with our legislative partners, we've supported the Georgia Rural Health Innovation Center at Mercer and worked to increase telehealth and health education opportunities in rural communities. Also proposed over $4.5 million in loan repayment programs this year to grow the number of healthcare workers in Georgia. Certainly appreciate the Senate Appropriations Chairman Blake Tillery and the House Appropriations Chairman Matt Hatchett for being with us today for this announcement and their support on a lot of these type initiatives. We additionally, on top of that, have called for an additional 102 physician residency slots as part of the program that Governor Deal began. With these additions, we will exceed the initial goal of that original initiative. And earlier this year, the Georgia Healthcare Workforce Commission we established in 2022 released its recommendations for how we can grow this vital workforce. Today's announcement that Children's Healthcare of Atlanta and Mercer University are partnering to tackle the need for more rural pediatricians is a great development, and we look forward to its impact. So again, thank you to CHOA and Mercer for what you're doing. Our rural communities certainly thank you for that. Georgia families, thank you. And Marty and I certainly appreciate what you're doing. And Donna Highland will now come to share more of this story with us. Donna, welcome.
Thank you. Thank you. Good afternoon, and thank all of you for being here, and especially thank you, Governor Kemp and Marty, for being here. Marty is doing such amazing work in child trafficking and sex trafficking. At Children's, for over 100 years, we've been serving the kids of our state. And every year, year after year, we serve children from all 159 counties, and we are so proud to do that. Last year, we saw 32,400 kids from rural counties, and those children visited us 78,800 times. That's why we're so excited to announce this partnership and this initiative to expand access and strengthen pediatric health care for children in rural Georgia and focus on improving access to pediatric care closer to home. We've established a dedicated fund, thanks to our Board of Trustees, and we have some of our members here today, of $200 million that will provide annual funding to help support our efforts in rural Georgia. And I want to thank our board for that support. And we are thrilled to announce our work together with Mercer University School of Medicine and the Georgia Rural Health Innovation Center. Both are such trusted partners in our rural communities and are so well suited to guide this important work in addressing the needs of Georgia's children. We are confident that together we are going to make a big difference. This fund will support our commitment to 10 full-time scholarships in 2023 through Mercer University School of Medicine for medical students specializing in pediatrics who commit to serving in rural Georgia for up to at least 4 years after residency. This program is going to train and keep pediatricians in rural Georgia. We have many well-trained healthcare professionals in rural communities, but often they require specialized programs to help children. A critical component of this initiative is working with rural hospitals to meet criteria to be kid-ready in the emergency rooms. This will build on our specialized pediatric care and expertise because we are the largest pediatric healthcare system in the country for emergency medicine. For the patients and families that must travel to Atlanta, we are also contributing to the Atlanta Ronald McDonald House Charities to allow them to further their mission of providing a home away from home for families that have to travel. We love Georgia's kids, and we value the many physicians, nurses, and healthcare professionals who care for kids wherever they live. We look forward to working together with more of those providers across our state to do even a better job of caring for these children. And now it is my great pleasure to introduce my new friend, Dr. Jean Sumner, the Dean of the Mercer University School of Medicine. She has been a tremendous advocate for the children of our state, and we are so honored to be working with you and Mercer.
Governor Kemp, Lieutenant Governor Jones, and all honored guests, and Donna. What a wonderful day for Georgia's rural children. I must start by sincerely thanking Donna Howland for her visionary leadership and commitment to all of Georgia's children. Thank you, Donna. And thank you to the board and the staff of Children's Healthcare of Atlanta. This amazing health system is vital to the health of children in our state and region. Governor Kemp, Speaker Burns, Lieutenant Governor Jones, members of the state legislature, you have never forgotten communities in the less populated areas of our state, and you continue to look for ways to help. Like you, Governors Deal and Perdue and Speaker Ralston worked diligently to improve access in rural areas. For these efforts, those of us that call rural Georgia home are very thankful. If you live and work in the less populated areas of the state, you know that rural Georgians are talented, resilient, determined, and productive. They, like you, care deeply for their families and work hard to improve their communities. They ask only for an opportunity. This alliance brings an incredible opportunity. Today is a pivotal day, a historic day, in the effort to improve quality and access to health care for children in rural Georgia. Mercer is honored to work together with Children's through this alliance. Children's support has made today possible. Children's Healthcare of Atlanta is a treasure. This year, we'll start with work in 8 rural hospitals and 5 rural pediatric practices, a rural pediatric alliance for education, and mental health screening and training and care, as well as other initiatives. It will grow. All will be carefully evaluated and revised if needed in our effort to find sustainable, effective solutions. This 10-year commitment will result in a stronger pediatric workforce, better prepared hospitals, scholarships for students who are committed to becoming pediatricians and serve the rural, underserved Georgia. The purpose of this effort is to expand access to quality care in rural communities and provide children with the right care at the right time in the right place. It is an effort to support care in rural communities while building a strong regional and state alliance of all providers and hospitals serving children. It will need every organization caring for children to take deliberate and thoughtful steps forward. Today, I am filled with hope and immense gratitude. Hope and belief that a new day is dawning for Georgia's children, their families, their physicians, and the rural and regional hospitals that care for them. Hope that rural pediatricians will be empowered to serve patients in their communities, and that families, when possible, will be able to stay closer to home for needed care and follow-up. I am proud to work for Mercer University, where there is tremendous support, unwavering support from our president, trustees, university leadership, and for the work of the School of Medicine and the Innovation Center. I am deeply, deeply grateful to Children's Healthcare Atlanta for their continuing commitment to serve all of Georgia's children, and this commitment to work on the needs of rural, underserved children. This alliance will be transformative. It will lay a foundation for healthier children, and healthier children become healthier adults. In 10 years, we will look back on today and recall that this day helped chart a new course for children's health. Our hope is that children across Georgia will receive the care and support they need to thrive, regardless of where they live. That, too, will be a great day. Thank you.
You know, when I got up this morning, poured myself a cup of coffee, and I reflected on today. When I thought about what we're doing here now, I think I said out aloud, what a great day to be a Georgian. Governor Kemp, Dr. Highland, President Underwood, Dr. Sumner, it is great to join with all of you as well as Lieutenant Governor Jones for this important announcement. I want to thank the leadership of both Children's Healthcare of Atlanta and Mercer University for their commitment to better health care in rural Georgia. I particularly want to thank the Board of Trustees of CHOA for their generous $200 million gift to fund this initiative. Thanks to that investment, we'll see support for rural pediatricians and hospitals. We'll also see support for workforce development, as well as behavioral and mental health initiatives across our state. Of Georgia's 10.9 million residents, approximately 2.5 million, 1 out of every 4 are children under the age of 18. That's not a huge population, that's our future. And that's what today's announcement is all about. I'm proud the House has led on important issues like combating maternal mortality, providing paid parental leave, both measures meant to support Georgia's growing families. I want to thank Chairman Parrish, for leading the House efforts on health care this session. Thanks to his leadership and the work of our various Health and Human Services Committee chairs, the House is well positioned to keep making advances in health policy. We look forward to working with Governor Kemp Lieutenant Governor Jones, and our friends in the Senate to do just that. Again, thank you to both Mercer University and the Children's Health Care for making today's announcement possible. Let me now turn the podium over to my friend, our Lieutenant Governor, Burt Jones.
Good job, Good afternoon. I don't think there's a whole lot to add to after all these fine speakers have gone before me, but I do want to echo what everybody has already said. Speaker Burns, obviously, and then Governor Kemp, thank you for your leadership on this. I want to thank Mercer University, Dr. Underwood, and Children's Healthcare, obviously, because this is a phenomenal day for the state of Georgia, and it's a phenomenal day. And I really think that a lot, if not most of the credit, because the blueprint was given to us by our former governor, Governor Deal here, a proud Mercer graduate, and leave it to two folks who grew up in Sandersville, Georgia here to figure it out. Because I'm from one of those small towns where access to health care and access to appropriate physicians and things of that nature and pediatrics is a big issue in rural Georgia. And Governor Kemp has been steadfast and wanting to be a strong supporter of rural Georgia, both in economic development, access to health care, access to broadband internet, a whole list of things that I know he's going to continue to do as our governor. But this is a great day to celebrate our fine people at Mercer University, which has a proud tradition there in Middle Georgia. Our partners are Children's Health Care and former Governor Deal, and we look forward to continue to work with our Senate leadership. We've got our two appropriations chairmen here, Blake Tillery and Matt Hatchett, and we've got our former appropriations chair, Terry England, who had a big hand in making this possible, and we're going to continue to do projects like this and maybe even expand a little on this blueprint, Governor, if we're lucky. So continued support of the legislature is key, and I'm happy to say we have that right now, and it's a good day for Georgia, and we appreciate all the partners. And I am open for questions, but I know you want the governor to answer them all, so we'll do that. So thank you, Governor. Appreciate it.
Thank you. Well, I thought real quick, I just want to recognize our Chief Justice of the Supreme Court, Mike Boggs. I think he's pretty proud of Mercer alumni. I'm glad to be here, and I am cognizant to who the crowd favorite is today, so I'll let Governor Deal close us out with just a word of welcome or thanks, just brief remarks, Governor, and then we'll take some questions.
I wasn't expecting to speak. I thought I was here just for decorations today. I've been at this facility and at this place many times, but this is indeed a great day, and I'm not going to be repetitive. But I want to thank all of those. I am especially proud of what the two partners, my alma mater, Mercer University, and I'm especially proud of what we're doing in our medical school at Mercer. I want to tell you one little tidbit about that. They are distinguished from any other medical school that I'm aware of. They look at the undergraduate class scores. They look at the MedCat exam. But they add one other ingredient. They look at the applicant's zip code. If you want somebody to go to rural Georgia, it helps if they grew up in middle Georgia or rural Georgia. They have a heart for their area, and Mercer is setting the way in that regard. And Donna and the Children's Health Care couldn't have a better partner in that undertaking as they reach out to go into the specialized area of dealing with children. Thank you so much for allowing me to be here. I'll make sure I wear my clothes and decorate the next time that you invited me. Thank you so much.
Well, thank you, Governor Deal. I know I put you on the spot there, but people can see your passion like ours for rural Georgia and your leadership on this issue, and especially getting more residency slots in the rural part of our state has surpassed expectations. With that, we'll open it up to questions from the media for any of the group that's up here.
Well, one of the things I've noticed since I left office is my hearing has declined significantly. But Greg, I think I can put together what you're saying. I think it takes everybody working in a coordinated effort. Sometimes we are a big state, as we all know, and it takes focusing on the small things sometimes rather than big things. But I commend Governor Kemp and his administration, and I think you've seen here the leadership that is in place here in this General Assembly, and they're committed to this prospect. And that's what it takes to be able to make sure that the taxpayers of this state get the results in the tax money that they pay, and that we all benefit and grow and move our state forward. And even though I didn't understand all of your question, I hope I got close to it.
All right. Thank you guys for being with us. Great. Oh, I'm sorry. Yes. Can you speak up just a little bit? Well, I think to me, when you look at rural Georgia, I don't want to speak for the lieutenant governor, the speaker, but it's like Governor Deal said, this is a holistic approach. This is one part of it. Mercer and CHOA partnering together to have more pediatricians in rural parts of our state. It's no different than Governor Deal's commitment and mine to Augusta University and AU Health and what they're doing with the 3+3 program to help get more residency slots and those physicians practicing just like these pediatricians will in rural parts of our state, recruiting people from those zip codes, as Governor Deal mentioned, so that they're comfortable with rural parts of our state. They'll stay there after these commitments are made. But it's also different models that we're using now in the healthcare systems, which the private sector is involved in that. We're certainly looking at that with the members of the General Assembly from an innovative approach. But also, we have got to grow rural Georgia. We got to grow jobs in rural Georgia, because if you do not have a tax base, if you do not have institutions and businesses and people that can support the healthcare networks, whether they're hospitals, clinics, physicians' practices, those are the things that we have to continue to do. And we've seen great economic success, just like we're seeing success tackling the tough healthcare issues in our state, in rural parts of our state, with things like this, with the program that at Augusta Medical College. But then, also what we're focused on to bring opportunity, higher paying jobs, and better tax bases to rural parts of our state. And we're committed to working with anybody to do that in the future. It is not an easy thing. Like you said, this is happening all over the country. But we are tackling those issues. And I want to commend Speaker Burns and his predecessor for the presence and commitment that they put on working on mental health reform in the Senate, and the governor's office was involved in that as well. And we had a great session last year in regards to that. But I think everybody up here realizes that was just a start on the mental health piece. We've got to continue that work, just like we've got to continue the work for access and cost availability for healthcare access in rural Georgia. Okay. Anybody else? Well, thank you all for being with us. Great day. Thank you.